Hi, this is Dr. Affan with Angel Kids Pediatrics from Jacksonville, Florida, and introducing again the caring for newborn babies. We started to talk about feeding generally and breastfeeding our newborn baby when we take those babies home, and we explained how doing a feeding and the 18 ounces a day that we needed. The picture is a little bit different when this baby is in the hospital. The first 2 days are a little bit tough. The good news is we're going to have a lot of help at the hospital, nurses, the physicians who are taking care of your babies at the hospital, the neonatologist, your pediatrician who might be part of your team inside the hospital, who is going to be involved in the care for your baby inside the hospital when your baby is born. Because babies, when they are born, it's a little bit tough for them to do the feeding for 10 minutes, as we explained, to be latching on the breast for 10 minutes, or even if they are taking bottle, which we don't recommend all the time. But taking that 10 minutes because they have never done this before, it's a brand new process for them, they might get a little bit tired with just swallowing and trying to suckle on that nipple from the mom. For more than 1 or 2 minutes, they might get a little bit tired, go to sleep, and then you wake them up, they start the process again, and so on and so forth. Added to this, mama might not have enough milk. We have what we call the colostrum, which is a very important, it's a thick yellowish material that has a lot of antibodies. We call them immune globulin, that is very, very, very protective for the baby's immune system, and it will go to the baby's stomach and intestine and clean it up from a lot of infectious materials. So this is very important for moms to be very careful about providing this colostrum for her baby. So because babies are not having enough of the milk when they are born the first 2 days, and because most of those moms, especially when this is your first baby, you might not have enough of the milk production, we are not expecting this baby to get 1 ounce from each breast. But as we mentioned, the very valuable material that you are producing, which is the colostrum, really we want this baby to get any drop from this colostrum from each breast. The nurses at the hospital, at the delivery room, your physicians will be helping you on how to express this. There are lots of methods, there are lots of ways to show you how to produce the colostrum and feed it to the baby. Now, because this baby is not getting the 1 ounce from each breast as when it advances in the day 3 and day 4, we allow those babies to go down 10% of their birth weight. So my message here for each mom, when your baby is born and second day of life, if they come and tell you your baby lost 4% of her birth weight, or 3%, or 5, or 6, or even 7% of her birth weight, please, please, please do not panic. Okay, this is all calculated. Everybody is so aware of this. We are just waiting for this baby to adapt to the latching process. She will get it. I can just reassure you, she is gonna get that. She will be starting to eat. She will know how to latch very well. We are very equipped in our practice here, and I'm 100% sure we are working with all lactation consultants in the hospitals around our practice here. They are very, very good in helping all the moms, lactating moms, in how to put the babies on the breast and how to help them to latch very good. Once this process is being optimized, those babies are going to be very adapted to how to start feeding. Once the baby is suckling very good and getting the milk, it's kind of a demand and supply issue. Once the demand is more, once the baby is latching better, the body of the mom is going to produce more milk, and the baby is going to get the amount of milk he or she would need. So what I wanted to tell parents is the first 2 days of life for this baby, the colostrum is really a gold standard, that we all need to have this baby exposure for the colostrum. So bear with the baby, bear with everybody in the hospital who's trying to help you to get the right feeding for the baby. Don't panic if there is no enough milk coming to the baby. Babies are really adapted to be able to stay a little bit with less food in the first 1 or 2 days. the nurses, the physicians will be weighing the babies probably more than once a day to see what the percentage of weight loss, and they are very much equipped into making sure that the baby is not losing more than 10% of his or her birth weight. And once, as I mentioned to you, that the supply is becoming in the right direction, and the baby knows how to coordinate the latching process, and the milk is coming available for the baby is going to be really doing very good into the feeding process. We're going to be talking next time in the third part of this about how mothers can get into producing enough amount of milk for their babies. Please subscribe to our YouTube channel, then you can get all the tips of the weeks.